More and more research shows just how important it is for overall health to get enough sun exposure. One reason being the sun provides us with vitamin D. This is important because vitamin D benefits the body in many ways. Research indicates that this so-called sunshine vitamin impacts not only your bones and your skeletal structure, but also immune function, blood pressure, mood, brain function, and your body's overall ability to protect against a range of illness. According to a 2019 review, the benefits of vitamin D are thought to include support for bone health and immunity, as well as resistance against chronic conditions, including heart disease, cancer, diabetes, and depression, along with infections and viruses. Given all these vitamin D benefits, it's unfortunate that so many people, at least 40% to 80% of Americans, depending on race, are lacking in this vitamin. It's estimated up to 95% of most people's vitamin D comes from casual sunlight exposure. However, because many people today don't spend time in the sun or regularly consume foods that provide enough vitamin D, most adults and children, even infants and breastfeeding babies, are now encouraged to supplement with vitamin D. Vitamin D, also called 25-hydroxy vitamin D, is a fat-soluble vitamin and is present only in small amounts in certain food, and it's made in our bodies only when our skin is exposed to the sun. It's considered an essential nutrient because the human body can't make it on its own without the assistance of food or sunlight. Calcium and vitamin D are two important micronutrients that work together in the body to support the overall health. The complex vitamin D and calcium relationship is especially crucial when it comes to bone metabolism, as both are integral to maintaining the strength of the skeleton. Together, they support heart health and a number of other bodily systems. Humans evolved to spend time outdoors in the sun. The body converts sunshine into chemicals that are then used by the body. In particular, when UVB sunshine lands on the skin, a substance in the skin called 7-dehydrocholesterol is literally converted into vitamin D3, the more active form. 7-dehydrocholesterol, or the cholesterol in our skin, which is very similar to cholesterol itself, converts pre-vitamin D and makes it into usable D3, which is sometimes also called pro-vitamin D. Pre-vitamin D first travels through the kidneys and the liver into the bloodstream, and then it's converted into calcitriol. Vitamin D actually becomes a hormone within the body, particularly a corticosteroid hormone. There's two types of vitamin D supplements, vitamin D2 and vitamin D3. The precursor to vitamin D is found in both plant and animal products, but animal-derived products of vitamin D3 are thought to be more absorbable and beneficial. Man-made D vitamin is made in one of two ways. The D2 is created by irradiating yeast and other molds, or by irradiating animal oils and cholesterol, creating vitamin D3. The type that our body naturally makes is called cholecalciferol, which is vitamin D3. The body is able to convert some D2 to be used for bodily functions, but it prefers to be able to use D3 much more. Unfortunately, most vitamin D fortified foods and dietary supplements usually contain a type of vitamin D2, which is neither absorbable nor convertible by the body into what it needs. D3 from animal products, specifically from cholesterol, is the closest to what sunlight naturally produces in humans when the skin works to convert the UV light. Vitamin D3 is therefore more active and is thought to be converted up to 500 times faster than D2. D3 has been estimated to be 4 times more effective in humans. Vitamin D plays a role in calcium absorption in the bones. Calcitriol, converted vitamin D, works with the parathyroid hormone to maintain the calcium levels. Additionally, it has an effect on other important vitamins and minerals that contribute to both health, including magnesium, vitamin K, and phosphorus. Vitamin D is partially responsible for maintaining phosphorus levels in the blood, and since it affects calcium's ability to bind to proteins, it's believed that it's also linked to vitamin K. Low levels can result in the softening of your bones, which is called osteomalacia, or a bone abnormality called rickets. Additionally, a deficiency increases your risk for developing osteoporosis and experiencing fractures or broken bones. Studies have shown that vitamin D benefits the bone health when taken in doses of 800 to 5,000 international units per day, and this can improve musculoskeletal health by naturally slowing aging of the skeletal structure and reducing the rate of fractures and falls in older adults that are over 65. Older adults with adequate vitamin D levels are more likely to be active, have improved muscle strength, and are less prone to falls and injuries. When levels are low, the parathyroid becomes overactive. This is known as hyperparathyroidism, and it results in a drop in phosphorus. Phosphorus, in addition to calcium and other compounds, are needed in order to properly mineralize the bone density. Exposure to UV light causes changes inside the human body, including an increase in vitamin D levels. Our immune cells contain receptors for vitamin D, and it's been shown that vitamin D benefits the overall immune function in several ways, including by preventing prolonged or excessive inflammatory responses. Emerging research shows that this vitamin D helps with healthy cell replication, and it may play a role in protecting against the development of autoimmune conditions, infections, viruses, and less serious illnesses like common colds and the flu. There's evidence that humans need enough vitamin D in order for macrophages, white blood cells that attack pathogens, to do their job. Vitamin D benefits seem capable of helping to strengthen the immune system by decreasing the ability of some viruses to replicate and grow. It's been shown to enhance the expression of an enzyme called ACE2, which is believed to have the ability to protect against acute lung injury. A 2020 study found that the average vitamin D level among residents of 20 different European countries correlates with the incidence of at least one serious acute respiratory infection. Higher vitamin D levels among older adults was associated with reduced rates of deadly infections, while low serum concentrations of vitamin D were linked to higher susceptibility. Because it can help to control inflammation, it can also benefit those with chronic disease and autoimmune disorders, including multiple sclerosis, rheumatoid arthritis, irritable bowel syndrome, and other digestive disorders. Diabetes symptoms result from a lack of insulin or inadequate insulin secretion following increases in insulin resistance. According to research conducted at the London School of Medicine and Dentistry, calcium is necessary for insulin secretion, and vitamin D benefits promote calcium absorption and utilization, therefore contributing to the regulation of insulin secretion. According to a 2015 study published in Current Diabetes Reviews, vitamin D replacement has beneficial effects on all aspects of type 2 diabetes, including the incidence, the control, and the complication of the disease. There's also mounting evidence linking low vitamin D levels to diabetes. According to research published in Frontiers in Endocrinology, vitamin D plays a role in factors that influence tumor growth, cell differentiation, and apoptosis. Vitamin D deficiency symptoms have been correlated with increased risks of cancer development, especially breast, colon, and prostate cancers. Researchers have found that increased sunlight exposure and circulating levels of vitamin D are associated with a reduced occurrence and mortality in many types of cancer. Research shows it can affect the risk of breast, colon, and ovarian cancer, possibly due to its role in the cell life cycle and its ability to block excessive estrogen. According to research published in the American Journal of Clinical Nutrition, improving vitamin D and calcium nutritional status substantially reduces the risk of cancer in postmenopausal women. Another 2018 study helped to solidify these breast cancer findings, as the researchers found postmenopausal women with 60 nanograms per milliliter or more of 25-hydroxy vitamin D, the main form of vitamin D in the blood, had 1/5 the risk of breast cancer compared to those under 20 nanograms per milliliter. Vitamin D benefits heart health by helping with maintenance of normal blood pressure and inflammation levels. A growing number of research points to the fact that low vitamin D levels are linked to increased risk for cardiovascular disease, since it's involved in regulating blood pressure, cholesterol levels, and inflammation. Animal studies have shown that the disruption of vitamin D signaling can contribute to hypertension, atherosclerosis, and cardiac hypertrophy. We know that humans who are deficient are more likely to die from coronary heart disease and other heart-related symptoms, according to research from the Vanderbilt University Medical Center. Because it acts like a hormone in our body and it affects brain function, vitamin D deficiency has been linked to an increased risk for mood disorders, including depression, seasonal affective disorder, and severe mood problems experienced during PMS, insomnia, and anxiety. Low levels can also interfere with proper testosterone and estrogen production, leading to imbalances that can result in many unwanted symptoms. Several studies have shown that vitamin D also affects our ability to make decisions, to concentrate, and to retain information. Researchers indicate that people with lower levels perform poorly on standardized exams. Many have poor decision-making skills and have difficulty with tasks that require focus and attention. Additionally, some research has shown a correlation between low levels of vitamin D and an increased risk for developing schizophrenia and multiple sclerosis. Some of the ways that vitamin D can benefit the skin include by supporting the immune system, controlling inflammation, and helping aid in skin cell growth, repair, and metabolism. Adequate levels may even help to prevent skin aging and also reduce redness, dryness, and other symptoms caused by eczema and psoriasis. Vitamin D deficiency symptoms can include fatigue, osteoporosis or bone fractures, susceptibility to infectious disease, higher risk for cardiovascular disease and high blood pressure, higher risk for certain types of cancer, autoimmune disease, depression, insomnia, arthritis, higher risk for diabetes, asthma, chronic pain, skin issues like psoriasis, and developmental problems in infants and children. Causes of a vitamin D deficiency and risk factors that make a low status are more likely to include a lack of sunlight exposure, frequent use of sunscreen, underlying health conditions like obesity, type 2 diabetes, insulin resistance, and hypertension, having darker skin. A higher percentage of African Americans, Hispanics, and Asians living in the US are believed to suffer from vitamin D deficiency. Being over the age of 70, certain occupations that limit outdoor time, including being a shift worker, a healthcare worker, and an indoor worker, being a nursing home resident or hospitalized patient, having celiac disease, Crohn's disease, or cystic fibrosis that interferes with absorption and processing of vitamin D in the intestines, kidney, or liver, and breastfed infants also are at risk of a vitamin D deficiency, which is why supplementing is now recommended. A general recommendation is to get about 10 to 15 minutes of direct sunlight per day without wearing sunscreen if you're fair to medium toned. If you've dark skin, you likely need more time in the sun to make enough vitamin D, about 40 minutes per day. Taking a vitamin D supplement can also be helpful for many people, especially in the winter months and for those who can't spend time outdoors. Foods with vitamin D include cod liver oil, halibut, carp, mackerel, eel, and wild-caught salmon. Recommended for children is a dose of 35 units per pound of body weight per day, or about 2,500 units per day for children aged 5 to 10. Recommendations for adults, including pregnant women, can go as high as 5,000 international units per day. However, many recommend much higher doses, such as 50,000 international units for a few days when you have a cold or a flu. To get the best vitamin D3 supplements, look for fermented, food-based sources of D3, preferably fermented with healthy bacteria. Vitamin D toxicity can potentially develop if someone takes more than 300,000 international units in a 24-hour period, or more than 10,000 international units per day for months. Vitamin K2 can help to prevent hypercalcemia, as it helps to control where the calcium gets deposited in the body. When someone's blood level becomes abnormally high, vitamin D side effects can include symptoms of hypercalcemia or high blood calcium levels, such as digestive issues like vomiting, nausea, and stomach pain, diarrhea, fatigue, excessive thirst, and frequent urination. Some possible drug interactions include steroids, epilepsy drugs such as phenobarbital, the weight loss medication orlistat, corticosteroids like prednisone, diabetes medication, blood pressure drugs, seizure medicine like phenobarbital, and calcium supplements and antacids. Vitamin D is a fat-soluble vitamin, and we mostly get from exposing our skin to the sun. Vitamin D benefits the overall health in many ways, such as by supporting bone metabolism, cardiovascular function, immunity against infections and illness, skin health, and cognitive and mental health. Vitamin D deficiency is believed to be very common because many people today don't spend enough time in the sun. The best way to maintain normal levels is to expose your skin to sunlight for 10 to 20 minutes per day. You can also safely increase your vitamin D levels by eating vitamin D rich foods like fish, cod liver oil, eggs, dairy products, liver, and some mushrooms to obtain the vitamin D benefits. Supplementing is a good option for many people, especially the elderly, infants, people who have malabsorption issues, and those who spend most of their time indoors. To obtain the benefits of vitamin D, adults need at least 600 to 800 international units per day, but ideally much more, up to 5,000 international units. For best results, be sure to get a 25-hydroxy vitamin D blood test to assess your levels and then supplement accordingly. For more information about herbs, supplements, and natural treatment plans, check out my website.